Karibu.
Bienvenidos.
Bienvenue.
Bem-vindos.
Welcome to Speaking Our Minds, a podcast where we take mental health back to basics, simplifying the conversation for all walks of life.
Hello, welcome back to our podcast titled Speaking Our Minds on the topic of mental health. Today is our second episode and we will focus on depression. I am your host, Leah Elliot. I work in the Nashua Division of Public Health and Community Services, and I'm the Behavioral Health Specialist. I'm also a licensed social worker. Today, we're going to talk about depression. Depression is a medical illness that, if left untreated, can have a major effect on a person's relationships, decision-making, employment, and life satisfaction. Depression can also cause suicidal thoughts or attempts. Most of us have experienced sadness in our lives, especially following a difficult situation such as a job loss, loss of a friend or loved one, or a move to another geographical location. For some people with support and time, they are able to return to their normal routines and meet the demands of their family and or employment. Clinical depression makes it more difficult for someone to move past these losses, or a person could even have depression without experiencing a triggering event. Our brains have many functions, but most importantly, our brains control how we think, feel, and act. And depression can impact how a person thinks, feels, or acts. Depression is a common mental health disorder and one that does not discriminate based on age, gender, race, or ethnicity. According to the National Alliance on Mental Illness, otherwise known as NAMI, 8.4% of U.S. adults, or 21 million people, have been diagnosed with major depressive disorder. On an average, one person in the United States dies by suicide every 11 minutes. In 2020, in New Hampshire, 279 lives were lost to suicide, and 53,000 adults had thoughts of suicide. Suicide is the 10th leading cause of death among adults in the United States and the 3rd leading cause of death among adolescents. It is important to talk to your primary care physician if you are experiencing any depressive symptoms so an accurate diagnosis can be made. Only a medical or mental health professional can diagnose depression. People often turn to friends, loved ones, or religious leaders to discuss their difficulties with negative feelings or situations. As it can be helpful to receive support to help with depressive symptoms, it is important to talk with someone who has the appropriate training in mental health to provide an accurate diagnosis and treatment plan. As I said, most people have difficulties in life where they experience sadness after a loss or a change in their life. Clinical depression, these symptoms should have been going on for at least 2 weeks, ongoing, and they occur in all aspects of a person's life. It is typical for a person to feel low energy when they're doing a task that they don't want to complete. But if someone suddenly does not want to participate in a preferred activity, that can be a sign that the person may be experiencing clinical depression. Other signs and symptoms include loss of interest or loss of pleasure in all activities, change in appetite or weight, sleep disturbances, feeling agitated or feeling slowed down, fatigue, feelings of low self-worth, guilt, or shortcomings, difficulty concentrating or making decisions, and again, suicidal thoughts or intentions. There are many factors that can contribute to a person being diagnosed with clinical depression. The first is trauma. When people experience trauma at an early age, it can cause long-term changes in how their brains respond to fear and stress. These brain changes may explain why people who have a history of childhood trauma are more likely to experience depression. The second is genetics. Mood disorders and risk of suicide tend to run in families, but genetic inheritance is only one factor. Brain structure is another factor. Imaging studies have shown that the frontal lobe of the brain becomes less active when a person is depressed. Depression is also associated with changes in how the pituitary gland and the hypothalamus respond to hormone stimulation. Other medical conditions can also impact clinical depression. People who have a history of sleep disturbances, medical illnesses, chronic pain, anxiety, attention deficit hyperactivity disorder, otherwise known as ADHD, they are all more likely to develop depression. Also, drug and alcohol abuse. Approximately 30% of people with a substance misuse problem also have depression. And finally, changes in hormone production or hormone changes, such as during or after a pregnancy or during menopause, can all lead to depressive symptoms. Serotonin is the chemical in our brain that is in charge of emotions and our mood, and it is stored in our stomachs, which is why when people experience depression, most likely they will report a eating change or nausea or upset stomach. It's because when they're experiencing those symptoms, the stomach is where the serotonin is and it responds. And that's why we say a lot of the time that what you eat and exercise can be critical to being able to manage depression, as depression is a chronic illness and one for there is no cure, only treatment currently. So for some people who have been diagnosed with depression, their brain does not produce the right amount of serotonin, and a person might need medication to help their brain produce the levels of serotonin needed to be balanced. These medications often are called serotonin reuptake inhibitors, and what they do is they take serotonin that is being processed by neurotransmitters and makes it so that they don't go away once that serotonin is released in the brain. So when you hear drugs like Prozac and Zoloft, those are all, again, they're called selective serotonin reuptake inhibitors, and they help to kind of recycle the serotonin that is in the brain and help to release it so that people can get balanced and have enough serotonin to feel at peace. Some people also experience something called seasonal affective disorder. The reduced level of sunlight in the winter months can cause a disruption to a person's internal clock. And reduced sunlight can also impact serotonin and melatonin levels in the body, which can cause depression. So that's why you might hear that during the winter times when the clocks change and it's darker earlier in the day, that people sometimes can experience depression at higher levels. Plus, if you think about it, a lot of the activities that we do to maintain our mental health, we might lose in those winter months. There's time outside, especially if you're working a 9-to-5 schedule. If you get out at 5, during the summer, you might have a couple of hours of light to be able to go out and exercise. However, once it gets dark, that might prohibit you from feeling safe to go outside, which can impact the amount of exercise you're doing. And again, those activities that might improve your mental health or help you to treat your mental health condition. Not all people who experience depressive episodes require treatment. However, treatment is important when depression is causing a problem in a person's personal or professional life. Mental health therapy is available to help a person to challenge negative thoughts or thinking. Medication is helpful when there's a chemical imbalance in the brain, as medications stimulate the serotonin and norepinephrine production, and those chemicals are crucial, again, to our emotional balance. At times, people can turn to drugs or alcohol to self-medicate or numb their brains to negative thinking. Using drugs and alcohol are not verified treatment options for depression and can, in fact, be very harmful to people with depression, as misusing substances can decrease natural hormone levels in the brain, such as dopamine, and that contributes to a person's happiness. So some strategies that can be effective to help with negative thoughts include journaling. If you're getting those thoughts out, they're not there ruminating in your head. Again, as I said, exercise is crucial. It helps to keep natural endorphins in the body that can produce some positive emotions, and as well as meditation. Meditation is important because it helps a person to stay in the here and now and to use their senses to keep grounded and to be in the moment instead of being carried away by some of those negative talks. If someone does start to have thoughts about harming themselves or others or thoughts of hopelessness, they should seek help right away. Calling the 988 crisis number can link the caller with a therapist who can provide recommendations or referrals in times of crisis. Please be aware that asking someone if they are having thoughts of suicide does not make them more likely to attempt suicide. Sometimes asking someone who is thinking about suicide might provide them with the opportunity to talk and explore their feelings and receive the help that they need. We all deserve to be happy, and if our brains are not allowing us to be happy because our brains are telling us that we are worthless, it's important to challenge those thoughts and learn techniques on how to do so. Our brains are supposed to keep us alive, not tell us the opposite. If you know a friend or loved one who has experienced a recent loss or situation that could lead to a depressive episode or clinical depression, check in with them. Ask them how they're doing. Often we may not know someone is experiencing depressive symptoms because symptoms are not always visible. There are signs that we can notice, such as them being absent or more present at work, coming off as though they may not be taking care of their physical needs as well. And however, we may not know how a person is actually feeling inside unless we ask them. The Nashua Division of Public Health and Community Services offers trainings on how to distribute Narcan, as well as the importance of using first-person language. Nashua Public Health and Community Services is also able to provide mental health first aid trainings to community partners. Please call 589-4538 if you are interested in scheduling a training. And if you or your loved one or are experiencing a mental health crisis, please call the New Hampshire Rapid Response Line at 1-833-710-6477 or 988. Thank you.
This has been a Fresh Gen Multimedia production. Thanks for listening.